Hello everyone, welcome to my channel Body Mind Healing. My name is Maria Sanchez. I'm a holistic health consultant, a family nurse practitioner, a psychiatric mental health nurse practitioner, and a doctor of nursing practice. The case for today is common eating disorders. Eating disorders are serious conditions that affect both the body and the mind. They are not simply about food, weight, or appearance. They often involve deep emotional pain, shame, anxiety, trauma, perfectionism, or a need for control. They can affect people of any age, gender, body size, or background, and you cannot always tell by looking at someone. The most common eating disorders are anorexia nervosa, bulimia nervosa, and binge eating disorder. Anorexia nervosa involves severe restriction of food, intense fear of weight gain, and distorted experience of body shape or size. Bulimia nervosa involves episodes of binge eating followed by attempts to compensate, such as vomiting, fasting, laxative misuse, or excessive exercise. Binge eating disorder involves recurring episodes of eating large amounts of food with a sense of loss of control, usually without regular purging afterward. Eating disorders usually do not come from one single cause. They often develop through a combination of biological, emotional, social, and cultural factors. Common triggers include dieting, weight-related comments, bullying, trauma, major life stress, family conflict, perfectionism, anxiety, depression, social media pressure, sports that emphasize body size, chronic illness, or feeling out of control in life. Warning signs can be subtle at first. A person may skip meals, avoid eating with others, become rigid about food rules, obsess over calories or weight, exercise compulsively, eat in secret, binge, purge, or feel intense guilt after eating. They may also seem withdrawn, anxious, irritable, tired, dizzy, or overly focused on body shape and size. These disorders can become dangerous because they affect the heart, brain, hormones, digestion, electrolytes, and overall nutrition. They can also increase the risk of depression, anxiety, substance use, and self-harm. That is why early treatment is so important. Treatment works best with a team approach. This may include a therapist, medical provider, a registered dietitian, and sometimes a psychiatrist. Care often includes medical monitoring, nutrition support, therapy, and treatment for related issues such as anxiety, depression, trauma, or obsessive thinking. Family support can also be very important, especially for children and teens. Therapy, including cognitive behavioral therapy, can help people understand patterns, reduce harmful behaviors, challenge distorted beliefs, and build healthier ways to cope. Depending on severity, treatment may range from outpatient care to intensive outpatient programs, residential treatment, or hospitalization. A spiritual lens can sometimes help people reflect on the deeper pain beneath the behavior, but it should never replace proper treatment. In a spiritual sense, anorexia nervosa may reflect a struggle with control, self-denial, fear of taking up space, or difficulty receiving nourishment from life. Bulimia nervosa may reflect a painful cycle of hunger and rejection, wanting comfort or relief, then feeling shame and trying to get rid of what was taken in. Binge eating disorder may symbolize unmet needs for comfort, safety, connection, rest, love, or emotional soothing. Across all three, the deeper themes often involve disconnection from the body, from inner worth, from emotions, and from a sense of safety. Healing is not just about stopping behaviors. It is also about restoring trust, reconnecting with the body, learning to receive nourishment without shame, and understanding that hunger, physical or emotional, is not a moral failure. Recovery is possible, even if it is not always linear. Setbacks can happen, but people do heal. The goal is not perfection. The goal is health, safety, freedom, and a more compassionate relationship with the body. A healthy spiritual perspective reminds us the symptom is not your identity. The body is not something to punish. Nourishment is allowed, and healing does not have to be earned through suffering. If you like this topic and want to learn tools to support your mental health, you will find more in my book Through the Storm by Maria Piedad, DMP, available on Amazon. If you resonated with this video, like it, share it, comment on it, and subscribe to the channel.